Carry on. So today we're going to look at the first trimester and what's happening for that lady and what can be done to make her feel more comfortable. So first we want to look at what is considered the first trimester. So actually in different countries the definition is different. Basically it's around the first 3 months. For some countries they say the first to the 12th week, and some say up to the 14th week. But basically, the approximate first 3 months or so, just a little over. So the first trimester is a time of a lot of changes. However, she might not look like she's changed physically, but there's a lot of things that are going on. Now, you've got to remember, for all these discussion about trimesters, every woman is different. Every pregnancy is going to be different. So I'm going to give this list of things that could be going on for her, but she might have many of them, but she might not have any at all. Some women don't even know that they're pregnant, even later into their second trimester, sometimes even longer, if you've heard of stories like that. So especially a woman who's not very in sync, she's having irregular periods, then she might not be very aware of her body, doesn't even know. But of course, many women, especially if they're practicing yoga, have a really good understanding and they know when they're pregnant. In fact, many women know they're pregnant even before they've done the test. They just feel it inside. So here's a few things that can be there during the first trimester. So nausea is very common to have. Many women, something like 70% of women will have some nausea at some point, so known as morning sickness. So nausea is not only in the morning, it can be at any time of the day, unfortunately. But for many women, it can also be more pronounced in the morning time. So nausea can be there, then vomiting sensation. So for some women, they do have such strong nausea that they are vomiting, and the vomiting can help to relieve the nausea. But some women do vomit a lot. Now, you would have already seen in one of the lectures about hyperemesis. So that's where a woman might be feeling nauseous and vomiting many times in the day. Even up to 20 times or 30 times in a day, which is very extreme. Most women don't have that, but it is not a very comfortable situation or feeling to have. As all of you will know, when you've ever felt nauseous, if it even goes for 24 hours, it's horrible. Whereas for a woman who's pregnant, it can be going on for a long period of time. So she can really need the relief from that nausea and vomiting. And we'll talk about that too. Then she can have some dullness. So she can be feeling very tired. And that tiredness, we often don't think about. When a person thinks about the first trimester, the beginning of pregnancy, yes, they think of morning sickness. It's a very common symptom, but so is extreme tiredness. And that's not talked about very much. So for a woman to suddenly feel really tired, she can be really worried because she's thinking, well, what's going on here? I'm only in the first trimester, and if I'm going to feel this tired right now, how am I going to feel in another couple of months? So it can be a little frightening to be feeling that tired. Many women can feel so tired that they just want to sleep all the time. Remember, a friend of mine, she was going to work, coming home, going to sleep, getting up, going to work, coming home, going to sleep. That's all she did in her first trimester. And it was tough for her, and it's tough for many women. The first trimester can actually be the most difficult trimester for a lot of women, especially if they're having a lot of nausea and they're feeling very tired. And I feel that the reason for that tiredness is basically the body is telling you to slow down. Because that first trimester, often she is doing many things still. She's most probably still working and doing everything, as women do. And it's a way of saying, actually, I'm trying to grow a baby here. This is the body. So please, you need to slow down. You need to give yourself some rest so that we can actually have a nice, healthy pregnancy and baby. So that's my idea of why that tiredness is there. So giving rest for the body to work on growing the baby, because in that 3 months, all of the body systems are in place. They've all developed. So it's actually really, really important trimester to take care of the body. So yes, there can be a lot of tiredness that she's feeling, and it's important for her to understand why she's feeling tired, what she can do about it, and that it may not stay. Most of the time, it won't be staying into the second trimester, but we'll talk more about that afterwards. But just understanding that it's common is actually really important for her to know, because it's not very well known. Okay, then she might have heartburn, so that's where the acid is coming up. This is especially if she's having a lot of nausea or vomiting. Heartburn is quite common in the first trimester and also in the last. Flatulence, so gases and indigestion, bloating, all of that can be there basically because the smooth muscle has started to relax more. So digestion is not as efficient as it was before. So those are the reasons why she might be having that. And of course, thinking of the nausea, acids coming up, it's quite uncomfortable. There is a loss or increase of appetite. So if she is having a lot of nausea, obviously she's not going to be very hungry. But for some women, if they don't have that nausea, then they might have an increase in appetite. Not all women do. Many people or many women actually find that they hardly eat anything in the first trimester. A lot of people have this idea that they need to be eating more in that first trimester, but actually, the baby is getting everything that it's needing, and it can be very tough for her to be eating if she is having a lot of nausea. The food aversions and cravings can be there. Especially they can be related more to how she is feeling with the nausea, because if she is feeling quite nauseous, she might crave very particular types of things that are very simple, sometimes more on the carb kind of side, things like dry toast, crackers, sometimes fruit, particular types of fruit, especially things that can be a little more on the sour side. So things like sweet lemon, what we have in India, musambi, can be there. Some types of foods like just a banana, which can be helpful for the increased heat or increased pitta. Then it can also be things like pears, simple types of fruits that they might prefer to be eating than, your heavy, salty, greasy, spicy types of foods. So really, really simple foods that are not going to create any more uncomfortable feelings. Then we have changes in the breasts. So that is also a very common symptom to have. Many women do feel that as the first symptom of being pregnant before the nausea comes, because nausea can usually come around the 7th week, and for most women it will kind of start to go in the 10th or the 11th week. Of course, it can be earlier, it can go on for later, but that's just the average. The breast changes can occur earlier on, so a woman can just feel that, okay, something is different here. And it can be that there's tenderness, so it can be so uncomfortable that one can't even lean on their chest. There can be heaviness, tingling sensation, fullness, all of that can be there. Then frequent urination is also common. Again, this is because the smooth muscle is relaxing. Very common in the first trimester, and then again in the last trimester. But the last trimester is not about the smooth muscle. It's about there being no space and the pressure being put onto the bladder, and also sometimes the pelvic floor not being as strong as they should be. There can be sleeping problems. And there can be a few different reasons for those sleeping problems. It can be because she can't get herself comfortable. So that can be because of those changes in the breast. So if she's used to sleeping in the prone position and she doesn't feel comfortable to do it because of that tenderness, then that's a problem. It can also be that she doesn't want to lay in prone position because she doesn't want any pressure on her belly, on her uterus. Um, of course, she can sleep in prone position if she feels comfortable, but sometimes it's actually the mental stress or worry about things that can stop her from laying in that way. Then she might be having problems with sleeping just because she's thinking about a lot of things. It can be that she's thinking about the viability of the pregnancy, like hoping that she's not going to have any kind of miscarriage. So especially if she has done in the past, that's going to create a lot of stress and anxiety for her. So she may be thinking about it a lot. Also, if she is having any kind of symptoms like having any bleeding or anything, she can be a little bit more worried. But she can also just be having so many things in her head that she's just not able to clear her mind and be able to go to sleep. There's just so many directions that the mind can be following, so many trains of thought. So that can definitely create problems of sleep. Then constipation. So constipation, again, because of that smooth muscle relaxing more. Generally, that constipation is only going to be there in that first trimester, and then possibly in the last trimester too. But of course, it does depend on one's constitution. Headaches can be there. Headaches can be there because of the change of the hormones, especially, but they can also be there because of the increased pitta, which often happens in that first trimester. And also, like if you look down at that last point, because of withdrawals, and I'll talk about that in a minute. Then there can also be faintness or dizziness. So especially if she's not eating very regularly, and especially if she is vomiting as well, having nausea, then she might be feeling very faint or very easily feeling dizzy. And that's why it is important that when you are going to be taking classes, you do allow them to eat something. Normally we say a couple of hours before yoga you shouldn't be eating, but for pregnancy we have to be a little different because it is important that they have something. Obviously it shouldn't be a big meal before they go into a class, but a piece of fruit, a handful of nuts, something like that, half an hour to an hour before is going to be important for them so that their blood sugars are stabilized and they don't feel suddenly faint or having low blood pressure. So looking at that last point, so there can be lots of different effects because of a change in diet and lifestyle. So for example, if someone had an unexpected pregnancy and they were smoking and they were drinking alcohol and suddenly they're pregnant. Now, everybody knows that you shouldn't drink alcohol and smoke cigarettes in pregnancy. It's so well known now because there's so much research that has been coming out for years and years and years. So most people, most women will stop those things during pregnancy. But of course, if they have been having those things continuously and for who knows for how long, it's going to have a lot of withdrawal effects. So she can be having strong headaches, she can be having shaking, she can be having vomiting, she can be having diarrhea. There's all sorts of stuff that can come from quitting smoking or alcohol, and not just those, but other things too. So particular types of drugs. And here I don't just mean the recreational drugs, but also some pharmaceutical drugs. A lot of people are on high doses of painkillers and they can be very addictive as well. So there's all sorts of different kinds of medicines and drugs that are there that are not recommended during pregnancy that she might have had to quit. So this change in her lifestyle can create a lot of withdrawal effects too. We've also got the point of caffeine, because for some women they might be drinking a lot of tea or coffee. They might just be living on tea or coffee, and we know that especially coffee has very high levels of caffeine. So it is recommended to have maximum 1 coffee per day in pregnancy and 1 or 2 cups maximum of tea, one or the other, okay, in one's diet. Obviously, herbal teas and herbal forms of coffee are also a good alternative, but she shouldn't be drinking 10 cups of coffee a day. That's really well known. Okay, so she can be having headaches because of the reduction in caffeine too. So looking at the emotions, so especially in the first trimester, there can be a lot of instability. The emotions can be very, very up and down, and this is mostly related to the hormonal changes that are occurring. She can be very irritable about things. She can be very weepy, but then on the other side, she can also be feeling very happy and have lots of feelings of joy. Um, you might have seen like ads on the TV where there's a woman, she's watching the TV, like she's watching a film, and she's very, very happy, laughing, and then something comes up and she's like crying because of it. And then again, she's happy again. So it can be really, really up and down, and it really is like that for some women. So there are, of course, a lot of practices that will help to stabilize those emotions a little bit more, but it can take a little bit of time for all of that to come into effect. Of course, anxiety can be there, fears and moodiness. Now, as I'd mentioned earlier, a woman who has a tendency towards anxiety, she's definitely going to have more of that during her pregnancy. There's a higher chance, especially if she's not following yoga. So there's a lot of areas that the mind can go to be anxious about, and especially that first trimester where there can be a lot of fears and worries about losing the pregnancy, losing the baby. It is really important to support her and help her in that time. Then we see the next point, so mixed feelings on pregnancy. So especially if it wasn't a planned pregnancy, she can be thinking about a lot of things. Even if it was a planned pregnancy, there's still going to be a lot of things going on in her mind. So thinking about if she wanted to have a baby for a start, one baby, or if she didn't want to have a baby, if she has had previous children beforehand and now she's having another child, so especially if it was an accident, there can be a lot of thoughts going around in her mind. Even things like, how are my other children going to deal with a new baby, and all sorts of things like that. It might be that sometimes a woman might have had children and they're already teenagers and then she becomes pregnant again, so that can be quite a surprise for her, and being a little worried about again going through that stage of early childhood and of course pregnancy and birth. It can be also that if she has had pregnancies before, she might be feeling very nervous, especially if she has had a pregnancy and she's miscarried, if she's had a stillbirth, or if she's had pregnancies and she's had abortions for them. There's going to be all sorts of emotions that are going to be coming up for her. And then there's going to be things like feelings related to being a mother. There can be fears of, am I going to be good enough? How is this society that I'm going to bring up this baby into? Am I ready to be a mother? Am I in a stable relationship to have a child? Do I trust myself? Am I confident enough within myself that I'll be okay as a mother? There's lots of things that can be there that start to come up from really, really early on. So it's important to have support. And this next point here, many things to think about. It's a big life change on all levels. So, all these kind of things are going to keep her up at night. So that's where yoga is really important. And of course, this last point, general worries that the baby's going to be okay, healthy and safe. Okay, that's very common, very normal. And especially when she's looking at, okay, this is the development of the baby, this is what's going on, this is how I should be feeling. So she can be worrying that things aren't exactly how they're supposed to be as well. So looking at the changes in the baby, so there's a lot of things that are going on in that first trimester. So by the 6th week, the baby is 13 to 16 millimeters long and the heart has started to beat. which is just amazing in 6 weeks. Now remember the counting of how many weeks a woman is pregnant. So basically they count from the first day of the last period. So of course she's not pregnant in that first week or 2 weeks. Basically that pregnancy is at the time of ovulation, which is approximately 2 weeks after, approximately the 14th day. Of course it can vary. So the baby is not actually 6 weeks old at that time. It's more like 4 weeks old. But that's just to give you an idea of how things are moving so fast. Of course, it does vary a little bit from country to country. And that's where also you'll see in different countries now 40 weeks is considered normal in many countries, but then in some countries it's also 41 weeks. Also, if a woman has been or had a very irregular cycle, she might not know exactly when that period was. So that can make it a little hard to understand exactly how many weeks the baby is as well. Of course, with things like ultrasounds now, it's becoming a little bit easier, but still with ultrasounds, they don't know for sure. They will give an automatic due date, but there's a lot of variability in that as well. So yes, the heart has started to beat, the brain, stomach, and intestines are all developing, and the bumps of the arms and legs are starting to grow. So all that is happening just by the 6th week. And by the end of the first trimester, the baby is about 11 centimeters long and weighing 45 grams. Of course, that's just an average, but it gives you a good indication, and all the organs have formed. So that's where you can see it's so important, that first trimester, because everything is getting put into place in that first 3 months. So there are a few things that we want to remember when we're going to be practicing. So first is if there has been any kind of miscarriage beforehand in past pregnancies, or if there has been any kind of bleeding. And one of the good things you can say for pregnancy is it is a time where she's going to be monitored much more than any other time, where she'll be seeing whether a doctor or a midwife, depending on where she is living and what options she wants to take for her healthcare. So what is good about it is that if she is having any kind of problems, you can always say, please go and check with your midwife, please check with your doctor, and then let me know. Because it's not expected that we should understand everything that's going on for her, and we are not doctors. There's a lot of training involved, whether it's a doctor or a midwife. So it's important that any problem that is going to be there, she gets things checked. So if there is bleeding, of course, we have to do practices very, very gentle. And it might have been that she is having a little bit of bleeding. She's talked to her doctor or her midwife. They've said, okay, she can continue things as long as it's not really, really heavy bleeding. But you still have to be very, very gentle. Now, the next thing is previous yoga practice. So if she has done yoga before, then she will hopefully have a good understanding of how she should be practicing. But it's also important to understand what kind of yoga practice did she do before, because now we know there's a lot of range in how people practice. There's a lot of different styles out there that have become very, very trendy, and not all of them are in line with the traditional yoga. So if she comes from a practice of where pushing and pain and discomfort is normal, then she has a lot of things that she has to think about and change for her prenatal practice. Whereas if she has been practicing traditional yoga and she's been comfortable, she's been stable, she's been very aware of her body and her breath, then it's going to be much easier. So moving to that next point, understanding of yogic principles is really important. And many women may have never done yoga before, and they come to yoga when they're pregnant. So we need to teach all of this to them. We need to teach them how to practice in a really safe way, and we need to teach them how to become aware of their body, their mind, their breath. So those are a few of the things that we want to be remembering. Now, I'm just going to go back to that previous yoga practice because this is actually something that can be the most challenging aspect as a yoga teacher, is to try to teach a yoga student who has a background in yoga, but not in the traditional way of practicing, and wants to do everything that they were doing before. Because if you look at yoga for first trimester, now there's a lot of variability in what is being taught. For some people, they teach that you can do everything that you were doing before in that first trimester. So some women question, oh, why can't I do this? Why can't I do that? I should be able to do this. It's only my first trimester. I'm feeling good. So a lot of things can come up, and it is important that we give them options. We explain really well why we're doing these practices, how it's going to be helpful for them, why we need to slow down a bit, why we need to start listening to our body more and more and more. So that can be a little bit of a challenge, but it's also a time where, say, that woman who was used to pushing, doing all the time, starts to slow down, starts to listen to her body. It can be really, really helpful time, and it really is a time where she starts to gain a lot more respect and understanding for herself. So let's look at the specific practices that we may want to do in the first trimester. Now, one more thing I'll mention is that a lot of yoga teachers don't actually allow women to come to their yoga classes in the first trimester because they're very worried about a woman miscarrying and blaming yoga. Now, there's a really, really tiny chance, very low chance, that anything one would be doing in the yoga practice would possibly be having an effect on a miscarriage, but still we don't want there to be any kind of link. So if you do have a woman come in her first trimester, you do have to be very gentle with the practices that you're going to be giving her. But it might also be that she doesn't come to the class, but she asks you what sort of things can she be doing at home. Because the other point, and I'm not sure if it's here further in the slides, is that a lot of women in their first trimester, they haven't made it public that they're pregnant. So they don't want to go out there in a class and say, hey, I'm pregnant, what am I going to do? And it might be that they're not going to announce it until they get to the end of the third month or into the second trimester. That's really, really common as well. So many women will choose to be fairly quiet in that first trimester, but it is actually really important that they have yoga as a support because, as I've mentioned, that first trimester can be pretty tough. So let's get back to the focus. So rest, conserving energy, building energy. So there's lots of things that we can be doing for that. Things like yoga nidra, simple types of pranayama, relaxation, meditation. So yeah, moving on to the next point of relaxation. Lots of different ways that we can be doing that. Surrender. Okay, that is actually a big one. Surrendering and letting go and realizing that, the body is growing a baby. We need to look after the body, we need to look after the mind, we need to look after the baby. So that might be that instead of doing all these crazy things, just calming down a little bit and just being really gentle. And also surrendering to that energy that is guiding, to become a little bit more intuitive with oneself, to start to learn to listen to what the body is needing, and understanding that there is that energy, that divinity within all of us that is always helping us and guiding and supporting. Nurturing oneself. Spiritual nourishment. So this is for not only the mother-to-be, but also for the baby. So she can start to work on herself more and more on the spiritual aspects, on different problems that might be coming up, on her own personality, lots of things that she can be working on there. Then you see the next point on preparation for the soul. So starting to think about what one wants in their baby, what kind of qualities. Now there's a whole lecture on that. Now I don't mean, okay, I want my baby to be a doctor or an engineer or something like that. It should be characteristics or qualities that are really important to have. It shouldn't be the conditionings that we have that we expect should be on a baby. So it's really important to understanding what is the difference between conditionings. So it may be that I want my child to be balanced, calm, happy, strong, that kind of thing. Then the next point, it is a time of introversion. Like I was talking already about personal transformation and spiritual nourishment. So it is a time to work on oneself. And as I mentioned earlier, so that 9 months, that time of pregnancy, really is a time when a woman can transform so much of herself. She can really start to understand herself at a much deeper level. She can understand how her mind thinks. She can understand her habits. She can understand her fears more. She can understand her strengths, more importantly. So there's a lot of things she can do. So it is important to kind of encourage that introversion for herself, because it's also a time where she has a bit of time to work on herself if it's her first pregnancy, because when her baby comes, it's going to be much harder to have those times alone. Of course, the way that she looks at things will have to be a little bit different when she's got a baby or children. She'll still be able to have introversion, but it will be a different form. And then this last point here, so major life changes are starting at this point. So her work situation, the relationships that she's having, her home life. So a lot of changes are there, and she might need to focus on particular aspects of them. So looking at the yoga practice, so the asanas that she's going to be doing should be restoring her energy, more on this restorative side, so very relaxed, comfortable positions. They should be grounding. So especially if she's all in the air and she's thinking a lot about all sorts of things, they should bring her back down to earth, what we call grounding. She can start like strengthening of her legs. She can start doing some nice gentle pelvic opening practices, and she can also do asanas that are going to be working on the digestive system. So there are many different asanas that we can be doing. Generally, for asanas, you're going to stay on the gentle side in the first trimester, just because of this chance of miscarriage. Now, as I've said, I've never known any woman to miscarry because of a yoga practice, though I will tell you a short story about one woman I know who was doing a very advanced yoga practice, and she was doing a lot of pranayama with bandhas and cleansing techniques and all of that, and she didn't know she was pregnant, and she did miscarry. Now, she doesn't know if it was because of the yoga practices or because it was just to happen. You never know for sure with the miscarriage, but still those kind of practices are not what we would want to be doing in our first trimester. So keeping it simple and gentle and relaxing. Then looking at the pranayama practice. So here the pranayama that should be done is to give more prana, not only to the mother but also to the baby. A lot of the pranayams are going to have that really nice introverting aspect, and of course all of them should be having a nice calming and soothing effect. So especially if she's feeling very stressed, if she's feeling very anxious or fearful, then pranayam is going to be really, really helpful for her. Basically, pranayam is helpful for every woman in her pregnancy for the whole 9 months, but here are some reasons why it's so effective. Then looking at some of the other practices, so Mula Bandha, the contraction here of the pelvic floor muscles, it can be done, but it is really important that she not only knows how to contract, but she also knows how to relax. Okay, both of those are very essential. Vaman, so Vaman or Kunjal Kriya, some of you may call it, so that's where we're drinking salt water and vomiting it out. So Vaman can be a really helpful practice for a woman who is already vomiting. If she's just having nausea, then pranayam, and I didn't mention that, but the pranayam, like the cooling pranayam, the Shitali, Sitkari, Kaki Mudra, all of those can be helpful. Ujjayi also, the victorious breathing, can be very helpful for nausea. But if she's vomiting quite a lot, then Vaman is actually going to be a much better option, where it's going to have an effect very fast. So imagine she's anyway vomiting, she's vomiting food or acid or whatever is there in her stomach. But if she does vomit when she wakes up in the morning, so she's drinking her salt water and then she vomits it out. So she's going to take out all that acid, but it's highly diluted. So it's not going to be burning her throat, and there's no food inside. So it's a very different experience to vomiting acid or food. And by doing vomit, it's going to help to balance the acid in her body, and it's going to reduce the pitta. So that chance that she's going to feel nauseous or vomit again is reduced a lot. So if she does vomit in the morning, generally she only needs to do it for a couple of days. In the morning, she can get that pitta under control very, very quickly. So it can actually be a really, really helpful practice to do. Now, some women say, "Oh, but I'm not used to vomiting. Oh, isn't it going to hurt the baby?" Now you see that women all over the world, they do vomit in the first trimester, and it doesn't create a problem. Yes, there are some. It is a little strong on the abdomen when you're contracting for vomiting, but there is a lot of padding around the baby, and surely nature wouldn't have had it in that way that vomiting is going to have that negative effect. Obviously, if it's very, very hard for her to vomit, like if she's never normally vomiting and she's just having nausea and she wants to get rid of the nausea, then it's better that she doesn't do vomit, she just does the pranayams, and that should help to control it, because vomit can also be related to emotional suppression. So if she never vomits, if she never vomited as a child or in her adult life, it can be really hard to suddenly start doing that. But of course, pregnancy can help that. So that's a bit about vomit. Then we have Laghu Shankar and the partial cleanse. So yes, we can do this if she's very, very constipated and other things are not working, but otherwise it's not really necessary, okay? Because naturally many women will have more of a cleansing effect in their body, and it's just not needed. So only if she's having constipation, she should be doing it. Meditation, now there's lots of different meditations. We're going to do many in the course as well. So they can be done in that first trimester. All sorts of visualizations too. So it can be like visualizations in Shavasana, or different forms of relaxation asanas. It can be visualizations put into meditations. They can also be put into Yoga Nidra. So there's a lot of different practices. Going on to Yoga Nidra, now you're going to have lectures about Yoga Nidra, but you can put specific things into the Yoga Nidra related to pregnancy. So for example, if she has a strong fear of childbirth, you can put a visualization in there of going through childbirth, feeling very comfortable, feeling very happy, very safe. So that can all be there in the Yoga Nidra. Then we have different types of mantras that can be used. So Gayatri mantra is there, Om, of course, and Mahamrityunjay, the healing mantra. So all those mantras can be used. And there are other mantras that are also recommended. You're going to have a lecture of mantra chanting as well. And you'll see this last point, the stress relief practices. So basically, there is this term known as the placenta clock. And if she's really, really stressed in her first trimester, it's like, it turns on a clock, which means that there is a higher chance, there is a link, a strong link that the labor is going to come early if she was really, really stressed in her first trimester. So it is important that she is as calm as she can be. Because we don't want her to have to go into labor any earlier than is necessary. From 37 weeks onward, okay, whenever baby chooses to come, but before 37 weeks, we'd much prefer if baby can stay inside. So that's a little bit about trimester number 1. Hari Om.